No one wants to suffer with sickness or injury. That's why everyone across the world deserves the best healthcare. Universal healthcare provides affordable costs and quality health services. This means the lower the costs, the more people will get treated. Access to healthcare is an important role for the government. I have done extensive research on the subject of healthcare to the countries that are not limited to but the United States, Norway, and Sierra Leone. Universal healthcare is very costly affordable to anyone that still will provide those health services to many countries around the world. The United States, however, is a country that does not have this universal healthcare system quite yet. In January of 2023, Gunja, Gummis, and Williams reported on the Commonwealth Fund article saying, while U.S. healthcare spending is the highest in the world, Americans overall visit physicians less frequently than residents of most other high-income countries. Since Americans are visiting hospitals and clinics less frequently, this means that there will be shorter life expectancies and a longer suffering of sickness or disease for not a desired amount of time. My diagram right here shows the US having a lower amount of physician consultations across the world. In Sierra Leone, this is one of the poorest countries for healthcare that does not provide that universal healthcare either. In January of 2010, Nancy Brady wrote an article on the website called One, based on what she observed in Sierra Leone. An observation made was, one immediate concern is the sheer lack of healthcare workers for the approximate 6.5 million people living in Sierra Leone. Because there is such a lack of these healthcare providers, this means that the residents of Sierra Leone are going to have an increased spread of sickness and disease, as well as a lower life expectancy among their residents. My diagram right here shows the steady flow of physicians until there is a crazy drop right here of the lack of physicians in this country, but it is slowly on the rise. Norway is one of the best healthcare systems in the world and uses this universal healthcare. In 2022, Sanas Kernikolos and Sagen wrote an article in the Health System Summary of Norway's website. It says Norwegians live longer and healthier lives than most other Europeans, with the gains over recent decades partly attributable to effective and high-quality prevention measures and treatment. Norway has the correct amount of physicians and quality healthcare services that will provide a longer life expectancy for the residents and a greater quality of life where they can fulfill their life and be able to get their diseases, sickness, or injury treatable at a very affordable cost. My diagram shows right here the life expectancy of Norway gradually increasing all the way from the years from 1765 to 2020. So you can see that the life expectancy is on the rise in Norway. When comparing the United States, Sierra Leone, and Norway, their way their hospitals or clinics look are drastically different. Sierra Leone has hospitals that are very not cleanly. You can show there a lack of physicians, as opposed to Norway and the United States have these cleaner facilities where a lot of protective personal equipment is used and a great number of physicians. Universal healthcare is a very common way that is slowly coming to countries or countries considering using this system so that affordable care can be used on their residents that allow a higher life expectancy and for more residents to be able to fulfill their life, as well as the extensive research that I have done has shown how universal health care has affected many lives in such a positive way. Having this healthcare is super affordable and can have a healthier population in many countries because many people around the world deserve this exceptional care at a very affordable cost. Thank you.